Bridge, new frontiers in type 1 diabetes.
I was fortunate to work with Ezio Bonifacio and Annetta Ziegler when they were looking in the TEDdy study that followed 8,000 children from birth who were already HLA selected, but we were able to generate a genetic risk score in this study. And this is the result from those TEDdy children. They were specifically focused on identifying very high-risk children, the 1 in 1,000 with a risk that at that time would be around 10% of being multi-antibody positive. And you can see that there when we stratify children by polygenic risk for type 1 diabetes. There's this very high-risk group. This directly enabled them to fund and do the GPAD study, where they could generate this polygenic score cheaply and efficiently. They screened 500,000 newborns and enrolled those very, very high-risk babies. And they effectively saved money on the number of people they needed to recruit because they could identify higher-risk people. An interesting thing to note within our field is that if we looked across studying common complex disease and these efforts to integrate genomics into clinical research and healthcare, type 1 diabetes is probably at the forefront. This study, along with other public health studies, genetic risk scores, are probably in advance of every other effort to integrate cancer polygenic risk and cardiovascular polygenic risk into routine healthcare. Type 1 diabetes is at the forefront, and that's really credit to the effort of many people across the globe.
Bridge, new frontiers in type 1 diabetes.